bring in Republican governor from Ohio, Mike DeWine. Governor DeWine, it's always great to have you here with us. Maybe you can give me a reason to hope. I'm an optimist, like I know you're an optimist. This weekend, I've been really concerned by a lot that I've read. South Korea's experiment to reopen up, not going really well. After telling everybody to get out, they had to close up a lot of places 4 days later in Seoul. You look at what's happening in the White House, where they're having testing every day. They're afraid of a possible outbreak there. In that Wisconsin rally in late April, protesters saying, hey, let's reopen the government. 67 people infected there. Of course, we hear horrible stories out of VA hospitals all the time. Latest 72 dead. Those numbers probably going to rise in New Jersey. So tell me, as you try to move to reopen your state, because so many people are in so much pain, how are you going to do it as safely as you can? We know there's no foolproof way to do it, but how do you do it as safely as you can, learning from these experiences?
Well, you know, that's the question we ask ourselves every morning and every night and all day, is how you can do it as safe as we can. You know, there's a risk if we do nothing. If we don't open up, there's a risk if we open up. We know that. One of the things that we've done in Ohio with our different professions and our businesses as we start to open them up, and tomorrow, for example, retail is open. In a few days, we get to hair, and we've tried to kind of layer that. But what we did is we put groups together of business people and health people, business people being people who know that profession, that's what they do, or they know that particular business. And we've come up with what we think are the best practices that we can come up with. And then, you know, we put those guidelines out. If a company or a person who, let's say they have a barbershop, whatever they have, if they can meet those requirements, then we start back. But the other thing that is so very, very important as we do this is, and I've said this to my fellow Ohioans, I guess, about every day, is we got to keep the distance. We've got to wear the mask. We've got to do all the things that we know do, in fact, make a difference as we move forward. So it's trying to minimize the risk. We know not to open up carries huge risk as well. We know what happens when the economy stays down for some period of time. You see all kinds of bad things happen, not just economically, but from a medical point of view or from a health point of view as well.
The governor, so how are you going to manage things? What plans have your team put together to manage the outbreaks that will surely happen? I mean, obviously the goal is to keep those outbreaks in as smaller clusters as possible. I know testing's not as robust and tracing ability is not as robust as you would like or anybody would like that's trying to figure out how to reopen the state. But what's Ohio's plans to trace where, let's say, Dayton, for instance, opens up and there's a cluster of cases in one part of Dayton? How quickly are you confident you can test and trace and then isolate those from the general population who get COVID-19?
Well, we've worked very hard to significantly increase our capacity. We've had Ohio manufacturers who have stepped up, for example, to make swabs. You wouldn't think you'd have a hard time getting swabs, but we've run into that, as many states have. You know, the other thing, you know, we put together, you know, a working group to work on that. Former Governor Dick Celeste, former Governor Bob Taft, I asked them to kind of head this up. They've rolled up their sleeves, and it's been very, very helpful. So we have a lot more capacity in regard to the testing. It is a work in progress. We're also standing up about what we hope will be about 1,800 health workers around the state who do the tracing. We've got to be focused on that tracing as we open up, and so we feel good about where we are. It still remains certainly a very much work in progress, but a lot of it just does come back to individual decisions. I mean, I've talked to Ohioans and said, look, this is no longer about what I order or about what our health director orders. It's about what you do each and every day. And it's going to depend on, how well we do every day.
From health safety to economic survival, Governor, as you work to solve this issue of reopening, are you prepared for the next challenge that will certainly happen? And that is that these companies and businesses are going to have less than half the customers that they used to have walking into their stores, sitting at their restaurants, going into their businesses. How can their economic survival be ensured? They're going to need money.
Well, I think that what's tied together is public confidence. And so the health issues, public health issues, and the economic recovery are so tied together. And so that's why we've got to get the health side right. We can open the whole state, and 90%, by the way, of our economy is going to be open by tomorrow. But if people don't have confidence, if they don't think they're safe at a restaurant, if they don't think they're safe and go into a jewelry store, then they're not going to go out, as you say, and they're not going to do that. So this is not going to come overnight. But that's why these two things, getting the economy moving and staying healthy, are so tied together. We got to get both of them right. And one doesn't depend on the other one.
Right. And Governor, so many people have talked about how Americans are divided. But, I see one poll after another showing that a good majority of Americans want the same thing, that actually we're more united on a major issue in this pandemic than we have at any time since 9/11. I'm curious what you've seen in Ohio from Republicans, from Democrats, from independents alike. Are you finding the same thing in Ohio, that most of your constituents, for the most part, yes, they want the economy open, but they want it open safely?
Well, I don't think there's any doubt about that. Now, I'll be honest, I've been criticized for moving too fast. I've been criticized for not moving fast enough. So there's clearly we have a divide. But overall, you're absolutely right. I think, great majority of people want to get this right. We may differ about how we get it right, but everybody gets it, that this is a pandemic that is still very much out there. The virus is still very much out there, but they also understand that we can't close this state and keep it closed, or this country, for a long, long period of time. So trying to get that sweet spot and figure out how we can do both is what, we started this interview with. That's what we focus on every single day. And I think that's what people want us to focus on.
Governor Mike DeWine, thank you very much for being on this morning. And up next, Joe mentioned this moments ago, a bump in the road to South Korea's reopening after the easing of restrictions helped lead to an infection spike. Keir Simmons reports for us next on Morning Joe.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.